Have you ever thought about the one decision in retirement that almost nobody prepares for properly until it is too late? Not your Social Security timing, not your pension payout option, not even your investment strategy. I'm talking about Medicare. And I know what you are thinking. Medicare is just health insurance. You turn 65 and you sign up. How complicated could it really be? I have been in this space for a long time, and I can tell you honestly that Medicare decisions are quietly costing thousands of American retirees real money every single year, not because they made reckless choices, but because they simply did not understand what they were actually choosing between. So in today's video, I am going to walk you through the real differences between your Medicare options. I am going to break down original Medicare versus Medicare Advantage versus Medicare Supplement plans. I am going to explain exactly what each one covers, what it does not cover, and what the true costs are when you factor in everything. And by the end of this video, you are going to understand not just what Medicare is, but how to actually choose the right type of coverage for your specific health situation, your income level, and your retirement lifestyle. Because this is not a one-size-fits-all decision, and the wrong choice can follow you for years in ways that are genuinely difficult to undo. So before we get into the comparisons, let me lay down some important foundational information that most people never fully understand before they enroll. And this foundation is what makes the difference between choosing Medicare strategically and just picking something because your neighbor did or because a commercial made it sound easy. The first thing you need to understand is that Medicare is not free. This surprises a lot of people. They have been paying Medicare taxes out of every paycheck their entire working life, and they assume that when they turn 65, the whole thing is simply handed to them at no cost. But that is not quite how it works. Medicare Part A, which covers hospital stays, is generally free for most people if they or their spouse worked and paid Medicare taxes for at least 10 years. But Medicare Part B, which covers doctor visits, outpatient care, and preventive services, has a monthly premium that every enrollee pays. In 2026, that standard Part B premium is $185 per person per month. And if your income was higher during your working years, that premium goes up significantly through what is called an income-related monthly adjustment amount, or IRMAA. High-income retirees can end up paying over $600 per month per person for Part B alone before any other costs are factored in. So the first thing to understand is that Medicare has real costs, and those costs vary based on your specific financial situation. The second foundational thing to understand is that Medicare has gaps. Original Medicare covers a very wide range of medical services, but it does not cover everything. It does not cover routine dental care. It does not cover routine vision care. It does not cover hearing aids. It does not cover most long-term care. And perhaps most importantly, Original Medicare by itself has no out-of-pocket maximum. That means in a year with serious health events, the amount you could theoretically pay out of your own pocket has no defined ceiling. That is a critical fact that most people never hear before they enroll. And the third foundational thing to understand is that your initial enrollment window matters enormously. When you first become eligible for Medicare at age 65, you have a specific window in which to enroll without penalties. If you miss that window and do not have qualifying coverage from an employer, you can face permanent premium penalties that follow you for the rest of your Medicare coverage. Not just for a year or two, permanently. A late enrollment penalty for Part B adds 10% to your premium for every full 12-month period you were eligible but did not enroll. That adds up to real money over a 20 or 25-year retirement. So understanding the enrollment rules before you get to 65 is not optional. It is genuinely important. Now, with that foundation in place, let us talk about your three main coverage paths and what each one actually means for you. The first path is Original Medicare, which is Part A and Part B together. This is the traditional government-run Medicare program. When you use Original Medicare, you can generally go to any doctor, specialist, or hospital in the country that accepts Medicare, and the vast majority of providers do accept Medicare. That flexibility is one of the strongest advantages of Original Medicare. If you travel frequently in retirement, if you spend part of the year in one state and part in another, if you have long-standing relationships with specific doctors you do not want to give up, Original Medicare gives you the freedom to see virtually any Medicare-accepting provider anywhere in the country without needing referrals or prior authorizations in most cases. That flexibility is genuinely valuable, and it is something that people who switch away from Original Medicare sometimes do not fully appreciate until they need care and discover their plan has restrictions they did not anticipate. But here is the challenge with Original Medicare on its own. As I mentioned earlier, there is no out-of-pocket maximum. There is a hospital deductible that resets not annually but per benefit period. And the cost sharing on Part B is 20% of the Medicare approved amount for most services with no cap. So if you have a $100,000 medical event under Original Medicare alone, you could potentially owe $20,000 or more out of pocket. For most retirees living on a fixed income, that kind of exposure is simply not acceptable from a financial planning standpoint, which is why the vast majority of people on Original Medicare choose to pair it with some form of supplemental coverage. And that brings us to Medicare Supplement plans, which are also known as Medigap plans. Medigap plans are sold by private insurance companies, but they are standardized by the federal government. What that means is a Plan G from one company covers exactly the same benefits as a Plan G from a different company. The only difference between companies is the premium they charge and their customer service reputation. The most popular Medigap plan for new enrollees today is Plan G. Under Plan G, after you pay your Part B deductible, which in 2026 is $257 for the year, the plan covers essentially all of your remaining cost sharing under Original Medicare. That means no copays when you visit a doctor, no 20% coinsurance on outpatient services, no hospital cost sharing once you are admitted. After that one annual deductible, your covered medical costs are largely handled. And unlike Medicare Advantage plans, which we will get to in just a moment, Medigap gives you the freedom to see any Medicare accepting provider in the country. The trade-off is that Medigap plans have a monthly premium. Depending on your age, your location, and the company you choose, a Plan G premium can range from roughly $100 to over $250 per month. And it does not include prescription drug coverage, which means you would also need to enroll in a separate Part D drug plan. But for people who use their healthcare regularly, who have ongoing specialists they see, who travel extensively, or who simply value the peace of mind of knowing their medical bills will not create financial catastrophe, a Medigap plan paired with Original Medicare is often one of the most financially sound choices a retiree can make. Now let us talk about the second major path, which is Medicare Advantage. Medicare Advantage plans are offered by private insurance companies that have contracted with Medicare to provide your Part A and Part B benefits, along with often additional benefits like dental, vision, and hearing. Medicare pays those private companies a set amount per member per month, and the private company then manages your healthcare coverage. On the surface, Medicare Advantage can look extremely attractive. Many plans have $0 monthly premiums beyond your standard Part B premium. Many plans include extra benefits that Original Medicare does not cover. And many plans include built-in prescription drug coverage, so you do not need a separate Part D plan. For someone who is relatively healthy and on a tight monthly budget, the low premium of a Medicare Advantage plan feels like a compelling deal. And for some people, it genuinely is. But here is what you need to understand before you choose a Medicare Advantage plan. These plans operate like managed care. Most Medicare Advantage plans have networks. That means you need to use doctors and hospitals that are in the plan's network to receive full coverage. If you go outside that network, you may pay significantly more, or in some cases receive no coverage at all except in emergencies. Many plans also require referrals to see specialists, and many require prior authorization for certain procedures or treatments before they will approve coverage. That prior authorization process can be a source of real frustration and delay when you need care quickly. Now, for people who live in one area year-round, who have strong relationships with local doctors who are already in a given network, and who do not travel extensively, Medicare Advantage can work very well, especially in the early healthier years of retirement when healthcare utilization tends to be lower. The monthly savings in premiums can be meaningful, and the extra benefits like dental and vision add genuine value for some people. But the concern that comes up again and again in retirement planning conversations is what happens when you actually need serious care. Because when you are dealing with a significant health event, the last thing you want to be focused on is whether your specialist is in network, whether a certain treatment requires prior authorization, and what your plan's out-of-pocket maximum actually is. Medicare Advantage plans have out-of-pocket maximums, which is better than Original Medicare alone. But those maximums can be as high as $8,000 or more per year for in-network care. And out-of-network costs may not count toward that maximum at all. So while a Medicare Advantage plan may feel financially friendly during healthy years, a serious illness or injury in a given year could expose you to thousands of dollars in unexpected costs that a Medigap plan would have largely absorbed. That is the core trade-off, and it is one that deserves honest consideration before you enroll. There is also an important flexibility issue that most people do not discover until they want to switch. When you first enroll in Medicare at age 65, you have guaranteed issue rights for Medigap plans. That means insurance companies must sell you a Medigap plan at standard rates, regardless of your health history. But if you enroll in a Medicare Advantage plan and later want to switch to a Medigap plan, in most states you will go through medical underwriting. The insurance company can review your health history and either charge you higher premiums or deny you coverage altogether based on pre-existing conditions. So the decision you make at 65 when you are relatively healthy can limit your options at 75 or 80 when your health situation may have changed significantly. That is a long-term consequence that is worth thinking about carefully before you lock into a Medicare Advantage plan based purely on the low monthly premium at the moment of enrollment. Now, the third path worth understanding is a Medicare Savings Account plan, which is a less commonly discussed type of Medicare Advantage that works somewhat differently. These plans typically have high deductibles, but Medicare deposits money into a health savings account that you can use to cover your medical costs before the deductible is met. For people who are very healthy and good at managing their own healthcare finances, these plans can work well. But they add a layer of complexity that many retirees find more stressful than helpful. And because they are still technically Medicare Advantage plans, they carry the same network and prior authorization concerns. So how do you actually decide which path makes the most sense for you? Here is how I think about it for most people. Start with your health. If you have ongoing medical conditions, multiple specialists you see regularly, or a history that suggests higher future healthcare utilization, the predictability and flexibility of original Medicare with a Medigap plan is almost always worth the higher monthly premium. You are essentially prepaying for certainty, and in healthcare, certainty has real dollar value. On the other hand, if you are in excellent health as you enter retirement, if you are comfortable with a network-based plan, if the extra benefits of Medicare Advantage genuinely fill needs you have like dental and vision, and if the monthly premium savings matter to your budget, Medicare Advantage may serve you well in those earlier and healthier retirement years. Just understand the trade-offs clearly before you commit. Also think about your income carefully. Because of the IRMAA thresholds I mentioned earlier, some retirees find that their income from pensions, Social Security, and retirement account withdrawals pushes them into higher Part B premium brackets. That changes the math on everything. A Medicare Advantage plan with a $0 premium still requires you to pay your full Part B premium. And if that premium is elevated due to your income, the total cost picture looks quite different than the commercials suggest. This is exactly the kind of interaction that most people never sit down and calculate before they make their Medicare decision. And that gap between what the marketing says and what the actual numbers show is where so much retirement planning goes sideways. Finally, I want to address something that comes up in almost every Medicare conversation. People ask whether they should delay Medicare enrollment if they are still working past age 65 or if they are covered under a spouse's employer plan. The answer depends on the size of the employer. If you or your spouse works for a company with 20 or more employees and you have qualifying coverage through that employer plan, you generally can delay Medicare Part B without penalty. But if the employer has fewer than 20 employees, Medicare typically becomes primary, even if you have employer coverage, and delaying could create gaps and penalties you did not expect. The rules here are specific, and the consequences of getting them wrong are long-lasting, so this is one area where getting personalized guidance before you make a decision is genuinely worth the time. Here is what I want you to take away from everything we covered today. Medicare is not just an administrative checkbox you complete when you turn 65. It is a foundational piece of your retirement financial plan. The choices you make at enrollment affect your monthly costs, your access to care, your exposure to unexpected medical bills, and your flexibility to switch plans down the road. Getting it right requires understanding what you are actually choosing between, not just which plan has the lowest premium today. Because the lowest premium plan is not always the lowest cost plan when you account for the full picture of what you might actually need over the next 20 or 25 years. Take the time to understand your options before your initial enrollment window arrives. Compare total costs, not just monthly premiums. Think about your health history honestly and consider what your healthcare needs might look like, not just this year, but a decade from now. Talk to someone who understands how Medicare interacts with your pension income, your Social Security timing, and your overall retirement income strategy. Because all of these pieces connect, and when you see the full picture clearly, you make much better decisions than when you are trying to evaluate each piece in isolation. If this video helped you think about Medicare and retirement planning in a new way, I want to ask you to do two simple things right now. First, please subscribe to Sallie Krawcheck Retired right here on this channel. And second, make sure you hit that bell icon so you get notified every single time we put out a new video. We cover the retirement topics that real people actually need to understand, the ones that affect your money, your health coverage, and your peace of mind in the years ahead. If you know someone who is approaching 65 or thinking about retirement and they have not looked carefully at their Medicare options yet, please share this video with them. It could genuinely save them thousands of dollars and a lot of unnecessary stress.